mind control is approved by the FDA. Just kidding. Elon Musk's Neuralink just got approved, so they can study on humans now.
Jeez, this is
brain
crazy.
implants. Brain implants. They're gonna put chips inside people's brains.
Have you seen those videos where they did it on monkeys and pigs?
No.
Like there was one video that they implanted this Neuralink, and the monkey was able to play ping pong. The you know the little ball that goes across the screen. The monkey was playing with it. So it's crazy that now it's gonna move on to the next step of human race. Would you get one?
I don't know, man. I don't know.
That's always a question. Like, would you get one? It's what I find really funny about this is, for some people, Elon is a genius. You know, just look at Tesla, look at Starlink.
Yeah.
Starlink, you know, and everything that he's doing with the Boring Company, he's a genius. But then when it comes to Neuralink, those same people are like, oh my God, I would never do this. I would never do that. But I don't know. Like, I would get it. Of course, I wouldn't get the first one. But we know people who have, like, you know, what is the thing that they put in people's hearts?
That when they have a
condition in their heart, you know?
Yeah, like a heart monitor type thing. Yeah.
So there's already technology that's helping people, you know? What about those people who have hearing aids? They implant it in their ear, in their head, so they would hear better. So it's not like this is something crazy. And to be honest, like, the people who are upset that are like, oh, I'm never gonna do this, are the people that have an Apple Watch that has a sensor that's reading your blood. They have an AirPod that's glued to your ear all day 24/7 and are texting on an iPhone, you know? So it's like, you kind of already have technology all around you 24/7, you know? So something like this, of course it sounds crazy, but if it works out, imagine all the possibilities that it can do.
Yeah, definitely. It's gonna... Yeah, it should be interesting. Like, I don't think it's going to be in the next 5-10 years.
20.
Maybe 20, where we're going to actually start to see people use brain implants or chips. Mm-hmm. Obviously, he's going to face a lot of lawsuits, a lot of hurdles, because it's like, where do you draw the line between, you know, like...
I don't know. It got approved. And
I mean, but let's keep in mind, the FDA be approving some stuff that shouldn't be approved too, you know?
Yeah. But they've done testing for such a long time. And I listened to the podcast where the main doctor that is behind this stuff, and he was explaining all the things that it could help. Like, it's pretty crazy. Like, it could detect stuff even before it even notices. It could detect eventually, like, bad cells that are going to turn into tumor, to turn to cancer, and get corrected by just sending signals from your brain to whatever that part is. So just imagine, you know, like, for your health, you know, so many times people are like healthy and something happens. I don't know, like this thing, I know us as humans, we're so scared of like, oh my God, this and that, but you never know. Right now, I think he's going to open it up to people who desperately need it, who are like in a life or death situation, you know, who have nothing to lose. You know, it's like, sure, I want to be part of this study and I want something for hope. Because if it is able to, he says one of the main ones is reverse blindness, reverse being paralyzed, reverse, you know, being death. And those are the three he wants to target. Eventually he wants to do, like I said, with like you're targeting bad blood cells, you know, get cancer. You know, cancer is such a big problem in our society. So I don't know, like imagine having this chip and ChatGPT is installed with it. Imagine all the possibilities that you can just like, kind of like the Matrix, where he was in the room, he didn't know how to do Kung Fu, and he told like, load me up on Kung Fu, and boom, instantly learn how to do that. So imagine I don't know how to speak French. I'm in France now. Boom, I'm able to understand French. I don't know. I of course, I'm not going to get the first one. You know, the first iPhone's not the best, but maybe like the 5th edition, it might be something that's going to be beneficial. I see it. I know a lot of people hate this, but I don't know. I'm also thinking that Neuralink is just the same as the Apple Watch. Apple Watch reads your blood work. Maybe right now it's an insert to your chip, but maybe eventually it moves up the next step, because even the Ring one that detects your sleep pattern. So there already is technology that's trying to move that, but maybe Neuralink is the most crazy one because it wants to insert it directly into your brain. Yeah.
Yeah, basically, you know, with Neuralink, it's the two things that it's trying to impact positively is healthcare, like you said, with diseases, spotting like, oh snap, give them an alert, this person's about to have a stroke or whatever. And the second one is our human capabilities, that maybe it'll go beyond our human capabilities, and it's going to be like we have a, M1 chip or M2 chip, the Apple chip, right, inside our brain, where we can process stuff. We can do things with our brain that our human capabilities can't, which is just crazy to think. But we've seen these type of things in movies. So it's crazy to think now it's like it could be a reality.
Yeah, I know the negatives of it is like, who's going to control this? Do we trust the people who are going to control this? Are they going to put stuff in our brain that maybe, can manipulate us, control us?
Vote for certain candidates,
do
this or that.
Yeah. But, we also have to understand that, like, there's a lot of risk to this technology, but there's also a lot of pros. So there has to be a balance. Look at the internet, there's a lot of pros to the internet, but there's also a lot of cons that happens in the internet. The black market, scams, fraud. But look at all the pros that come with it. So I don't know. Of course, I would not get the first one. I would not. I would wait till like 5th, 6th, 7th edition, and then I would think about it. I would really think about it.
Yeah, that's scary. It is scary. It sounds scary. I'm still on the fence of it, but I don't know. I guess once we see more research, we see.
Exactly. It's not like he's going to force it on us. That's also, we got to understand. Like, this is going to be like your choice whether or not you want to do this. But imagine if you score a better IQ test, you do better in school, your kids or whatever, or even your parents, they get older, they have this, and it could detect cancer cells or heart attacks and can reverse it at the same time with you literally not even noticing it. You're like, oh shoot, you go back to the doctor and it sends you, Neuralink sends you a text like, we just reversed this. Like, oh my God, I could have had this, but this detected it before I even knew it was going to happen.
Yeah, it's definitely going to be very interesting. Let us know what you guys think in the comment section below. Would you guys put a brain chip implanted? Would you implant a brain chip? Would you do it? Would you do the 1st, 2nd, 3rd, 4th, 5th edition?
But what's crazy this is the monkeys have to charge their chip. So they have to put like a little helmet that like charges it. So it's very interesting how they're doing it. But if you haven't looked it up, look it up. This is also a private company. So I know as soon as this becomes a public company and it goes after the healthcare, Apple's moving into the healthcare industry because Amazon wants to start their own healthcare industry because it's something that we haven't really like pushed boundaries that far.
I just thought about that. So like, who knows if this would even come to existence because of all the lobbying that happens in DC by, the Pfizers, all the pharmaceutical companies, that if this happens, these people are going to get wiped out. They're going to lose a huge portion of the market because Neuralink is going to solve a lot of problems where you're not going to need all those pills or pharmaceutical companies. So there's going to be some pushback for sure.
Yeah.
So we'll see what happens. I mean, if the FDA already approved it, that's already a huge win for Elon Musk. And obviously their stock of Neuralink eventually, once it becomes public, it's going to explode.
If it works like it does, like
everything he touches is becoming a gold mine for sure. Even the Boring Company, with all the interesting gadgets that they sell.
The cool flamethrower. I wish I got in it. I think it tripled in price afterwards.
Just how cool that thing is. I don't know why I didn't get it. Man,
I want a Tesla. I really imagine being able to drive the car with your Neuralink or be able to communicate, just like you're just sitting in a room, you're just sending mind thoughts to each other.
It already drives you to where you want to go without you telling you. Okay, you want to go here? Oh, I see you. You're hungry. You want some coffee? Let's go to coffee real quick.
Or it'll tell you, no, you can't eat that donut. You already ate too much. Your cholesterol's kind of high.
If you eat that donut, you're gonna get a stroke.
I don't know.
But yeah, so it's we'll see what happens. Let us know in the comment section below. What do you guys think about implants in your brain with Neuralink? Would you do it? Would you not? And be sure to like, follow, subscribe for more amazing content like this one.